Why does the face sag over time? Why does it get droopy like this? Well, the answer really depends on the layers in the face. So there's 5 layers. Number 1 is skin. Number 2 is superficial fat. Number 3 is muscle. Number 4 is deep fat. And number 5 is bone. And every layer is changing over time. So the skin loses its elasticity, it picks up sun damage, it gets overstretched like a tracksuit bottom that gets baggy at the knees. So a lot of our treatments are going to be aimed at improving the skin and protecting it. The superficial fat underneath the skin slides down, and that's what's happening here, is it really slides down, and there's various ligaments that hold to its spread. But we use treatments then to try and get some lift and support. The muscles over time, they get overactive in some areas, and in other areas, because of fat loss, they get overstretched, and again, they work less efficiently. Underneath everything, the whole template or support of the face, which is the bony structure, is changing. It's like a table, and over time that table is shrinking and the cloth is not shrinking, so there's a bit of a mismatch and things start to sag down. It's not all bad news. The good thing is we've loads of different treatments that can look at what's happening at each layer and address those separately. The bad news is, because there's so many layers and so many changes happening over time in a predictable manner, that there isn't a single treatment that'll fix everything. So sometimes people will come in and they think a single treatment like botulinum toxin or a single treatment with a dermal filler like hyaluronic acid will fix everything, but they just can't. So number 1 is always going to be skincare. That's the low-hanging fruit, and that's the area we can often make most improvements in for a smaller budget. And those changes over time make a big difference to the skin, and we should all be doing them. The second is you can use products to help lift. You can give deep support, which will help replace some of that lost fat, especially in areas like the cheeks and the temples. The muscles we can affect with botulinum toxin, or sometimes we'll just put a dermal filler underneath the muscle to give it support and help it work more efficiently. And then think of that table and the tablecloth. When you're 20, the bone structure is a strong table and the cloth is lovely and tight and fixed to it and looks nice and strong and elastic. Over time, we know our hips and spine are thinning and at risk of getting less strong. But the same thing's happening in our face, and the bones, especially that jawbone, the mandible, is shrinking. So all of this soft tissue, what does it do? It follows the path of least resistance, which is downwards. So we can do lots of different treatments at different layers. There isn't a single treatment that'll fix everything, but we're trying to keep our treatments as subtle as possible so that we get a natural result and it's buildable over time and doesn't look too drastic. Take care, bye.